defal barke barke nag góor ga nee na du jëmm ñuy dox waaye lépp loo xam ne barke nga ca boo ko xoolee di nga ko gis ñu ngi ba seen bépp yëngatu fépp foo xam ne bëgg nañ fa yegg ak réew mi rek yàlla dimbale leen ci loolu lii la ñu mënoon wax salaamaaleykum wa rahmatulah wa barakatu.
I'd like to introduce myself. My name is Anna Baumann. They call me Anna Tanka Tanka because that is more easy to pronounce than Baumann. The first time I came to the Gambia was in '96, and then I got a lot of clothing to give away, and I went first to the prison, to the state prison, but I wasn't allowed in. Then I asked the taxi driver where is a psychiatric unit, and then they said we don't have one. Finally, we found out it was Kampama in Banjul. So when I first entered Kampama, I could not believe my eyes. It was really an old prison, and I thought that these people need a better future. So we started first painting and bringing new beds, etc. And later we thought this is no use because everything was broken and leaking and whatever. So a friend of mine, he worked in government, he was Sering Muruwanjai, and he told me, why don't you write a letter to the president? And that's what I did on a Friday afternoon, a fax. In those days it was faxes. So I wrote that fax and I explained to the president how important it is for a country as the Gambia to have a proper unit for psychiatry. And I told him also, it can happen to you, it can happen to your mother, your sister, all your relatives. And it is very, very important that we do something and let us show that this nation can do the job. So I was very much amazed, but in a couple of days I got his reply that when I come back to the Gambia that I could have some ministers with me to find a nice plot of land. And that is how it started. We found a plot in Salaji layout. I made this choice because it is far from the temptation of drugs, etc. I don't know if that is true, but that was my idea. Anyway, we started raising funds, and that took 4 years, 5 years. So finally, we put some bricks in the corners of the plot of land that everybody knew that is a governmental land, you cannot touch it. And then we could start building after we had raised well, a lot of money, 495,000 euro. That is what we needed. And then Fjordshanahan started building, and we made the idea, where the female wing and whatever, we did all ourselves. And I'm very, very proud to see that the cooperation together with RVTH, what is now Edward Francis Small Teaching Hospital, is still there, and we can work together. We have good management now here, and that is also very, very important. And I'm very, very proud how everybody is managing here, and we have a nice garden. A lot to be done because we have now the facility for 100 patients, but also in the future it will be very, very nice if all hospitals like Viam, Farafeni, Brikama, they had a small unit where patients who are not inside this hospital could find their medications over there. But that is a long way to go yet. But we can do the job. We keep trying. Thank you.
Good day to you all. I am Baba Mane. I'm the acting matron of the Tanka Tanka Psychiatry Hospital. Tanka Tanka Psychiatry Hospital is under the auspices of the Edward Francis Small Teaching Hospital. And then there is the only psychiatry hospital in the Gambia. We have a patient capacity of 100 patients. And then I have a very dedicated staff in the hospital here who give care to the people that we think are very vulnerable, and then they need the attention of the public. They need the help of individuals. So the bold and then the hard-working nurses are the ones taking care of these people. And then these are the people from our homes, our society, who were once contributing immensely towards the development of this country, but today they happen to see themselves in this condition. So it should be every individual's task or responsibility to make sure that these people are cared for. And then I definitely want to commend Trust Bank for this bold and then giant step that they've taken to give attention to the mental or the psychiatric institution or hospital. And I'm calling on all other stakeholders or institutions to emulate Trust Bank Gambia Limited to be able to do the same thing. Because it's like it's a hospital where anybody can be admitted, and then it can be at any time of your life. So on that note, I'm calling on everybody to make sure that you contribute your little code that you can do to the delivery of good mental health care in the Gambia here. And then, as I always say, I definitely commend my staff who are giving care to the patient in the hospital here. Without them, it will have been very difficult for the people and then the society where the patients are coming from. But we also calling on the society to make sure that they give attention to these people. These people need their love, they need their support, and then they need their care. And then this is what we're all looking for, so that they can also be able to fit within the society. The stigma and the discrimination which they are facing, we need to try and clear it out. Because there are people who are very instrumental in the society. They can be able to contribute their own quota towards the national development that we're talking about. So I'm calling on the society and individuals to give support to these people. These people need our support today than ever. So on that note, I'm calling on everybody to give the necessary attention that these patients need, so that they can also be able to bring out their strength, their skills, and then the talent that they are having within themselves to be able to put or make an impact in the development of the Gambia that we're talking about. Tanka Tanka Psychiatric Hospital was established in 2009, but from then up to now, we've seen the impact that it has made in the Gambia here, with the community mental health team that goes nationwide. Every month, they go and meet the patient, because not every patient can be able to make it to the psychiatric hospital here. There are others who are very much stable within the society, and we think that the community is the best place for them to be. So on that note, we have a community mental health team that goes nationwide every month to meet those people within the community. So we're calling on everybody to give support to that community mental health team, to give support to the Tanka Tanka Psychiatric Hospital, so that what we're all looking for in our Millennium Development Goal, we can be able to meet it, inshallah. So on that note, I thank you all.
In the health sector, Trust Bank has been heavily involved with the APRC hospital in Farafenye, with the health facility in Gunjur, in Basse, Liman Street Clinic in Banjul, the Edward Francis Small Teaching Hospital Sanatorium, locally called Venture. And in particular, Venture is what I want to talk about. If you look at the health facility, which has been here during colonial times, and it suffered a lot of neglect over the years, and Trust Bank took it upon itself to really do a total refurbishment of the facility to what it is today. If you look at the picture, as the minister said earlier, if you look at the pictures of how it used to be and how Trust Bank has been able to transform it over the years, after committing close to $15 million, it's really a sight to behold. And then we shift our attention to Tanka Tanka here. What the sanatorium and Tanka Tanka have in common is that there are two health facilities that Gambia has a very great need for, where the patients that are normally admitted to these facilities, there's a lot of stigma around. You look at the sanatorium, it's normally targeting people with highly communicable diseases like tuberculosis and stuff like that. And here caters for mental illness. And I can tell you that these two predicaments are two that Gambia wholesale have turned their backs on. There is a social stigma attached to Venture. There has always been a social stigma attached to Kampama and now Tanka Tanka. And what we are doing here today is donating $250,000. It's a lot of money for some. It's not too much for a place like this. But if you ask me personally, what do we hope to achieve by being here as a bank? And I will tell you that if we can create the awareness like we're doing now, if we can attract attention of the whole Gambian people to what is going on here, if we can reverse or change the stigma with which people regard these places, then I would have thought then our job is completed. On a final note, sometimes I look at these things. I was sitting there in the ceremony, listening to the minister speaking, listening to Anna Bowman, who is the proprietor, or who really is one of the main benefactors of what is going on here. All the speakers today, the words of praise that they had for my bank, I listened to it, and at the same time, I know too that the first time I visited, I went back to my office and I knocked on my MD's door, Mr. Njai, and I explained to him what goes on here. Straight away he said, I have to visit. And I think for me that was the first big achievement. The fact that I spoke to him and straight away he was committed to come. Now why am I telling you this? I'm telling you this because it's so gratifying.